Good morning, good afternoon, good evening, depending on where you're listening to me from. I am Dr. Quigier, and today we'll be talking about osteoarthritis. I want to share with you the story of one of my patients, Janet, a 60-year-old female officer who is in charge of handling traffic in one of the big cities of the country. She came to me because she was complaining of progressively worsening knee pain. The knee pain is usually worse in the evening. And over the past few days, she noticed some crackling sounds in the knees when she was moving and some stiffness at some point, at some time in the day, and she decided to consult. Following laboratory and imaging examinations, we concluded that she had osteoarthritis of the knee. So, what is osteoarthritis? Osteoarthritis is a wear and tear arthritis. If you look at your knee joint, it's the meeting point between two bones, the thigh bone and the leg bone. And covering the articular surface of this bone is some sort of a gum, like the rubber that your slippers are made out of. And when you wear slippers for long, what happens to it? It eventually wears off and becomes thin. It's the same thing with this gum or cartilage that covers your bone. As you age, as you use it, it tends to wear off and eventually it exposes the bone, and bones start frictioning against bone, and it's a very painful process. The pain will progress to crackling sound and deformity of the knee. Wear and tear arthritis, that is what osteoarthritis is about. Who is at risk? Are there some particular people who are more exposed to developing this disease compared to others? The truth is, it's a disease of aging. It's a natural process. All of us at some point in time are going to develop some sort of arthritis, but the severity, the degree will vary from one person to another. The body has a tendency to destroy and build back itself. Destroy and build back. When you're younger, the destruction rate is, no, the reconstruction rate or the building rate is higher than the destruction rate. But when you get past a certain age, your 50s, your 60s, destruction take an upper balance compared to reconstruction, and this favors the process of arthritis. Now, if you add to this other factors like extreme physical exercise, overweight or obesity, prolonged standings, prolonged strain on the joint, you hasten the process. And this will explain why two people of the same age may have the same complaint of knee pain, the same diagnosis of osteoarthritis, but different intensity or different severity. Can the disease osteoarthritis be cured? Pay attention to the answer to this question. Can it be cured? The truth is no. As of today, there is no finite treatment for osteoarthritis. Treatment has the aim to alleviate your symptoms, to make you feel better. As I said, it is a natural process. We can slow it down, we can make the symptom subside, but they are likely to reoccur. It is very important. I'm stressing on this point. It is a natural process because we have realized in practice that many patients move from one doctor to another, from one pharmacy to another, from one traditional doctor to another, because in their mind they expect their body to get back to its initial state, which is very rare, or not to say not possible. It's a natural process. You were young, you became an adult, you became an elderly. Being an elderly comes with a certain number of physiological changes, and these physiological changes brings about a number of ailments. So there is no definitive cure. The pain will not disappear. It is likely to reoccur. What then can be done? You will be asking yourself. Yes, if you suffer of chronic knee pain and you consult your doctor and you are being diagnosed of osteoarthritis, he is going to share with you a number of things to do to make the symptoms of pain subside. One of them is pain medication. He's going to prescribe you pain medication under strict control. Another one is some recreational activities like swimming or stretching that will have the aim of limiting the strain on the joint and opening the joint, because it's a problem of friction, it's a problem of contact. So stretching exercise are going to open the joint and limit the friction. Also, the use of walking aids depending on the joint affected is going to help improve the symptom. Osteoarthritis is a disease of aging. It is a natural process which can be hastened by some other factors on which we can act to prevent or to limit the symptom. There is no definitive cure. Thank you very much for listening to me. This was osteoarthritis, and I look forward to discuss another medical issue with you. Have a nice day.